Welcome once again to Colorado and Me. I'm your host, George Blaze. Well, we're in such trying times, troubling times between COVID-19 and everything that's going on in terms of social unrest and the search for social justice. The issue of mental health comes up in all over the country amongst everybody, but particularly in the African American community. It's been an ongoing discussion that we've been having because of some of the stigmas attached and because of the lack of resources many times that are available to many people in many African American communities. Today we're going to be talking about self-care, mental health awareness, and making sure we're all doing the best we can to take care of ourselves. Joining me now is Thelma Craig, Chairperson for the Colorado Black Health Collaborative. Thelma, it's good to see you today.
Thank you. Well, glad to be here. Thanks for inviting me.
Absolutely. Now, when we talk about these kind of issues, I don't ever want to pick on people because it's a very sensitive topic, and you want to make sure that we're sensitive to people. But one of the things that's bothered me over the last couple of months, in terms of the discussion openly, particularly on social media and amongst Black circles in mental health, is some of the stuff that's been going on with people like Kanye West or what have you, who are big figures who are clearly going through issues and yet have parlayed some of this attention into part of their money-making schemes in some ways. And it's hard for people to really take seriously what may be going on with some of these individuals and how much we should have more compassion than criticism when we're looking at these kind of things. I was wondering if you could comment a little bit just about these kind of things, these high-profile individuals in the African-American community, and whether or not we're doing enough to really have compassion.
Well, I don't see myself or label myself as a mental health expert. I'm a community organizer, community-based organization dealing with health and health equity. But I see that as a call for attention and a call for help. And I think that we see that a lot in our community because, we have all these traumas. We have historical trauma, oppression and violence against Black currently now with COVID, and the isolation, the uncertainty and grief from, financial stresses and human loss. And so that people tend to react in the community, and we should show more compassion to community members, but we also should find ways to give them help and refer them to resources that will be helpful to them. Stigma around mental health is out there. People are afraid to seek help. People are afraid to talk about it. People are afraid to address it. So I think that if we show more compassion, make referrals, talk to a friend of the person who's having problems, so maybe they can make some referrals so they can get some adequate health care and, have adequate access to health care. And maybe not even traditional psychology or therapy. We can introduce people to coaches. There are some new innovative holistic approaches to getting care that we can start introducing our community members to when we see that there's a challenge. So I think that makes it more inviting.
Now, things have gotten better over the years. I'm old enough now, about to be 50 years old, where, I remember growing up in the 70s. And everybody had, we had to visit your cousin's house, cousin Renee, who they just kept in the back room somewhere, and nobody really talked about what was going on with that individual. Looking back on that, I think we've moved beyond that. But this is the upbringing I remember growing up, is that mental health care, if someone had mental issues in the house in the Black community, they kind of pushed them off into a corner and fed them and just kept them there.
Yeah, push it off to the side because of the stigma, and especially in our community, they would say that they would put shame on and calling people crazy, but put shame on mental unhealthiness. And so I think that really put a lot of fear into people's lives, into their families' life. They didn't want to have that light shown on their family member because there's some shame and, that they are associating that with shame. And so, but I think now that we're getting a little bit better with that. There are a lot of resources. I think, education and awareness, is more and more in our community. And I think that more providers are African-American or Black. And so I think that we're reaching out to the community and really making people aware so that we can eliminate some of the stigma around mental health issues. So I think that we're coming out of that. I grew up in the same era. and we called people crazy, and that wasn't good. But and then people didn't tend to want to seek mental health care because they thought that it would be against their faith or their religion. And so I think that's really we're letting that go now, and we're seeking mental wellness a little bit better these days. So,
In terms of seeking help, professional help, therapy, or what have you, it seems to be one of these things, particularly in the African American community, particularly amongst Black men. We don't want to look for help. We barely go to the doctor sometimes, even when something's wrong, depending on how old you are. Trying to cross this threshold and to make sure that African American men and women really, if something's going on, that you have to reach out.
yes, they do have to reach out because seeking health care, mental health care really should be a priority in our lives. I think historically, Black men looked at that as being weak, if they wanted to talk to someone. But I really do think that we're changing. We're turning the corner with this, and more Black men are talking to each other. Like I said, they're seeking providers who look like them, and they're letting go of some of that stigma. I think it's happening. I see that a lot in our community. Sometimes people don't think that there's anything wrong because they feel healthy, physically they feel healthy and they feel strong, but I think that that's changing. I think that people, are really looking at themselves differently now, and they're become a little bit more woke, as you might say, and really able and willing to access some of the resources that are available to them.
How important do you think it is to have, if you seek therapy, to find a therapist that looks like you? How important is that?
I think it's very important. I really do, because a therapist that look like you could be coming from the same background, the same cultural background and exposure, and have the same historical perspective that you had, and what really is causing depression, or what's really, what's some of the stigma and that is happening to them, what's happening in their life. I think so that it's great that we have providers that look like us. And we have a program here in Colorado, in the Pipeline program, where we are really making education and awareness available to Black students so they can seek education in those fields, in psychology and therapy, and public health, in areas where we can have more of us who look like us, because I think that's really what really supports our community seeking help, because they'll feel safe and they'll feel comfortable with providers that look like them and coming from a perspective and a historical background that they are. So I think it's very important that that happens.
In terms of looking at some of the issues, particularly emotionally and mentally going on, particularly amongst our young people in the community, it's been my experience and what I've observed and what I've read and what I've studied, that we have a generation of young men, particularly, who are raised without father figures in their house. And this seems to be a common thread in terms of a disjointing of them moving into manhood, and how they express themselves sometimes becomes super negative. I was wondering if you could share your thoughts on family structure and how important that is in terms of overall health of the family and the community.
I think family structure is important, but I also think that, really education and more aware, educated and aware Black women who are mothers and who are raising their sons, they realize that they can't teach him to be a man. So there are so many community organizations, so many keep my brother's keeper organizations, so many role models, in their extended family, so many role models in the church or in of the schools. And I think that more people and more people are accessing those services and really letting their kids, become engaged in those services so they can be around men who have, who could be role models for them. So I think that we're becoming more aware of what our sons need, so that they can have a strong image of a Black man, so that they can seek those healthcare needs that they, when they have trouble or when they have issues seeking healthcare. So, but I think that the parents are more and more accountable these days. They're understanding that it's okay to be psychologically open and reach out to other people to get the help that they need, especially particularly with young boys and working with men. I think, and I'm so proud that more and more Black men are stepping up to the plate and willing to be those role models for those young men who don't have fathers in their life. I'm seeing a lot of that in the community, and that's what community is all about.
One of the main things that's missing in a lot of communities all across this country are the kind of rites of passage organizations or things that young Black women and girls can go through. They don't have these resources. A lot of attention is paid to young Black boys, but young Black girls, you went through a stage where everyone was talking about Black girl magic, indigo children, and all this stuff. And it seems like that went poof, I guess, when Me Too came up. Everyone forgot about talking about Black girl magic.
Mhm.
Rites of passage for young Black women. How important is that?
I think it's very important. And I think in our community it's happening. We just started a women's health program where we really want to empower women to really learn about self-care, self-love, so that they can be stronger in who they are. I think that those groups are still around. They're still available. We just sometimes they need funding. They need support. They need community support to come along and stand with them to keep those programs going and stronger. But that's still happening. Black Girl Magic is still on the forefront, I think. And I think that it's going to get better now. Particularly, I think with all that we're going through, like I mentioned, COVID and being isolated, I think people are really realizing how important it is, that we have these groups, that we are coming together and that we are supporting each other. So it's happening. My hope is that it will get stronger and that we will maintain these outside systems, these community systems, that we wrap our arms around each other. I think it's happening. I really do.
It's really vital, and I know these things are going on out there, and people just need to really pay attention to the young girls. One of the things that me personally, I have daughters myself, and for a while there, I really enjoyed. Every year we had a daddy-daughter dance every year, but then social politics changed, and people felt that daddy-daughter dances were exclusive of other people, and they canceled it in my school. And I didn't know exactly how to react to that or what to do about it. Um, I don't know. I wonder if you can comment a little bit on that.
Well, I have a daughter and I have a son, and my husband and daughter had the experience of the father-daughter dance, and I thought it was great. I don't really see any harm in that. I think it's just bonding, and it's really letting young women see how men are supposed to treat them through their dads. So I think it's a great opportunity for women to build, girls to have relationships with their fathers. I think it's great. So I don't know, why that's stopping. I think that it's still happening here in our community. It's really happening here. So I don't really can't comment too much on why that's not happening, because like I said, I have a son and a daughter, but I also know, it starts at home, and you can do it in the comfort of your home, where you can teach your daughters and you can teach your sons about why are you here as parents. You're here to give them these lessons and these messages and these ways in which to live and to be and to grow. So it starts in the home. May not necessarily need to go outside and do it. You can create those kind of social activities for yourself. You yourself can take your daughter and make it an annual event that you're going to take your daughter on a date, take your daughter to a dance. And I think that's really important. And not just girls and with their fathers, but girls with their mothers. I think it's so important for young girls to realize how important their relationships with their moms are. Because that's really what it's all about, is recognizing the grace in the women that God put in your life, so that you can learn from that, really bring about that awareness so everybody can pay attention. So it really starts at home.
A couple of years back, Vice News did a documentary series on a high school in Chicago. I think it was called Last Chance High. This was like the last stand for some of these high school students who, if they didn't get through this program, then they were going to be released. They were no longer going to be going to school. They were going to be expelled completely. And one of the things that I gleaned from this documentary was that many of these individuals, many of these young people suffered from various levels of spectrum disorder or what have you, had been diagnosed, had been prescribed medication, but the parents were simply not keeping up with the kids' medication. And as soon as they got them back on the medication, things started to clear up. This is one of these other issues. It's like we really got to take this stuff seriously as far as the medication part of it. It's not a bad thing.
It's not eliminating that stigma, really. And when you have systems like that or programs like that, really the important thing is to bring those parents into those programs and have workshops and have seminars and instruction to teach parents and let them know the importance of having these kids, take their medicine or follow the plan. I think engaging the parents in more things is really helpful. Even the model with like LeBron's school. LeBron takes care of not just the student in his school, in the classrooms, he takes care of the whole family. So if you can engage the entire family in the school and in these programs, I think you can strengthen, the relationships with the children and keep them on track. And then the parents will become more and more aware of what the kids need because they're learning too. So there's never a place where you can say that the parents are done learning. They can always get information and education as well. And then in that, they can learn how to make sure that they are administering the medications and things that the kids need because they're on the program as well. So I think it's a holistic approach. Bring everybody, introduce them to new ways to help them remember and how important it is to take medication. Introduce some holistic activity. So I think that getting the parents involved in the education of the kids, paramount.
Absolutely. For people who are unfamiliar with Colorado Black Health Collaborative, give us a little bit about what the mission is, the kind of work you do, and the resources that you provide.
Okay, so I was 30 years at the Colorado Department of Public Health and Environment in public health, community disease, epidemiology. And so I had an opportunity to work with the Office of Health Disparities, then it was called, it's the Office of Health Equity now, to go out into the community and really inform the community about health disparities and the prevalence of disease. So we created, all the Black employees at the department, we created this event called the Family Reunion, where we would bring everybody together. We had Bronco players, bring everybody together to eat and dance and do everything we do at a family reunion. But then we stopped and introduced them to a PowerPoint presentation that had the prevalence of disease and where we are, the social determinants of health, and talking to them in layman's terms about health equity. And the community was shocked because to be able to see it on paper and how our community is affected and how we are disproportionately affected with all this disease, they said, wait a minute, you're from the health department. We don't want you to come out here and do and give us your report and talk and go back and never come back into the community. Let's do something about it. So that very day is when we started the Colorado Black Health Collaborative, and they named the group. They wanted to work with other groups as a collaborative. They didn't want to create silos, but we brought the community together. We became a 501c3 in about 6 months. And some of the same community members that day are with us now, board members. So we created the Colorado Black Health Collaborative. Some of our programs that we do, we have a barbershop program. We're in the barbershops every Saturday, taking blood pressure and glucose testing and providing education about heart disease. We have a women's health program, teaching women about self-care and holistic approaches to care and innovative ways to take care of yourself. We have a resource directory where the community that very day said, we want to know a list, a guide, so that we'll know where are all the resources that are available that really cares about Black people. So we created a resource directory. So currently we're working on tackling menthol in the Black community, where we are really talking about for decades how the tobacco companies have targeted Black people with menthol and how 90% of Black people who smoke cigarettes, they smoke menthol, and how that's really killing us. The largest high prevalence of Black men dying from lung cancer. So that's another project we're working on. So we have several programs that we work on to engage the community. This is about community engagement. And so we do, I was looking around, we do have a number of other programs, but it would take me all day to tell you, but we're on the web. We have a website. And we really work on insurance literacy. A lot of Black people, large percentage of Black people, they do have insurance, but really don't know how to navigate those systems. So we have an insurance literacy program that we worked on. So we work on all the social determinants of health, anything that we see from cradle to grave that affects the Black community and their health. we're working on it.
Clearly, and I think to myself about a close acquaintance of mine, Dr. Terry Mason, who was a urologist in Chicago for a long time, ran the Cook County healthcare system for a long time. At some point in his career, he got tired of doing surgery on people. He got tired of carving people up, and he realized that changes in diet and nutrition could keep him from having to do all this surgery. So he stopped doing that altogether and dedicated his life to veganism and teaching people, Black people particularly, about nutrition and taking care of themselves in this way. And I see this as a trend everywhere I go, that people are starting to be like, you know what? Yes, doctors are there, and if there's a problem, they are there for you, and the healthcare system's there for you. But there's so many things we can just do at home, particularly now that we're all doing nothing at home. Find
Right.
a new recipe, find a new diet. You have time now.
And I think that's happening. And like you said, like another one of our programs is quarterly forums where we bring people together every quarter. We get an average of about 90 people on a Saturday to talk about things like nutrition. We had a forum called, like you talked about, food, soul food. Healthy soul food is not an oxymoron. You know, you can be healthy and still have soul food. Learning how to eat differently, learning how to make those greens, you know, those black eyed peas in a healthy way. So we have forums like that every quarter to teach people, you know, how to live. We talk about at those forums, you know, we go as far as what your mama didn't teach you about heart disease. Your mama didn't teach you about erectile dysfunction. Your mama didn't teach you that you have oral and dental problems and related to erectile dysfunction. We bring all those topics, teaching people how to change behaviors and live differently. But I really like what you talked about, the food. We had the soul food meeting and really teaching people how we can change our diet. We can eat healthy soul foods.
And I know a little bit ago you mentioned about trying to educate the Black community in terms of insurance awareness and understanding and intelligence in that way. This is one of those other things where it's like, depending on the health issues people are having, there are many doctors, and I'm not going to disparage all doctors, the medical profession as well, but I've had my own personal experiences where they want to instantly push you into maintenance as opposed to giving you a way out. Maybe lose 40 pounds as opposed to getting put on a statin. I mean, these little things where I had to figure it out myself. You're not always going to get that advice from your physician, and you should
No.
look for that kind of thing.
Right. And that's really what we're about, education and awareness. And that really empowers people to take care of themselves and learning how to talk to doctors. You know, that really is a challenge. And where our community, you know, I was taking care of my mother and my father, you know, before their death. And I really realized they were intimidated by the healthcare system. They didn't know how to navigate those systems and talk to the physician and ask the right questions. So that's important for us to teach each other how to navigate those systems, talk to the healthcare providers so that we can ask the right questions, so that we can, you know, take control of our health and of our, you know, and know what questions to ask. So there's so much to learn and so much to do to change behaviors and turn it around, but to be a healthy, more healthy community.
And that's really the goal, is to be a more healthy community. And particularly during these times we're living now, I mean, this COVID-19 thing has really opened up awareness in people's eyes to just how vulnerable many of us can be. One of the things that I've noticed just from my own kind of, I don't know, layman's research on what's going on with coronavirus and what have you, is that the people I know who've done the front work on making sure their bodies were strong and healthy and their immune systems were up based on diet and health aren't as affected as the
Yeah.
people who've just been living normal lives. And there's a big difference when you get coronavirus between if you're a person who exercises regularly, eats right, and what have you, and you're just a person who lays around, does nothing.
I know. And speaking of COVID and these times too, we make it a point to educate the community about COVID-19 and what's happened in the Black community, because, you know, we were disproportionately affected by, it still is, by COVID-19. Because I don't know if you heard, but early on, the myth was that Black people can't get COVID.
Right, right. I
You
heard
know,
that.
and so we're like, wait a minute, we started a task force so that we can make sure, you know, that we have that adequate and correct information is sent to the community, is available to the community, educating communities. We conducted 3 or 4 webinars talking about, you know, COVID, you know, and what you should do and how you should do it and what questions to ask and how to take care of yourself. So really bringing about awareness in the community so we can get correct messages, you know, because we're disproportionately affected by COVID, but then they started out saying we're not, you know,
Right.
affected at all. So we want our community to be aware. you
Well,
know.
I'll tell you what, for all those people who just woke up yesterday, I'll tell you, anything that's out here in the world that they say is starting to kill people, it's going to kill your black self first. So
Yes.
please be aware, please be careful and keep yourself educated. Thelma Craig, Chairperson for Colorado Black Health Collaborative. If people want more information or want to participate or get some of your resources, where can they go? What's the best way to reach you?
We have a website, www.coloradoblackhealth.org. We have a website, we have a telephone. It's on the website, so all the information you need. We have a Facebook page. Please like us on Facebook, Colorado Black Health. We have an Instagram page. And in those ways, you can always reach me or any of the other board members or staff from our website. So we look forward. We're building a coalition around tackling menthol. We build a coalition around all the projects that we have. And so that's really engaging the community so that they can feel like they're contributing and being culturally responsive to each other and helping each other to live healthier lives. So visit our website.
Well, Thelma, it's been a pleasure talking to you. And that's a pretty impressive bookcase back there. If you were going to pull a book out tonight before you go to bed and read it, which one would it be?
Oh, I have so many. The first one I see is, oh man, I love books. You know, I just wrote a book. Oh, you know what I'll do? I'll just give myself a little promo. My book. I just wrote a book. Let's see. It's called Understanding Better by and By. And we were talking about, it's called Recognizing Grace in the Women Placed in Our Lives for Our Healing. And so, you know how we don't appreciate our mothers, our grandmothers, our aunts, our friends until, you know, years later, it hits you. I know why they told me that. I know why I was taught that, you know, and that's the grace that was placed in our life for our healing and our learning. So that's what my book is, right? So that's the book I'll pull off the shelf and read tonight.
Thank you so much. And thank you all for watching. We'll see you next week right here on Colorado and Me.
Thank you.